Two, one. We're live. We're live. We're live. Hello, 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 everyone. Sorry for the lateness. The good doctor had to see some people. So, first of all, I'd like to introduce everybody to Dr. Stephen Tourjee. And I did say that correctly, right?
That's right.
Thank you, sir. And thank you so much for joining us. Here we go. I got the first person going. Why aren't you on yet?
Thank you for your patience. Glad to be here.
All right. Thank you so much. So, hey, everyone, thank you so much. So, today we're going to have a little discussion called Arrested. I came up with this name title. So, for those of you that are getting ready to join in, screw yous. So, listen, I came up with it. If you don't like it, it's life. Arrested Adulthood Mental Health Misinformation and the Refusal to Grow Up. Okay. How do you like that, doctor?
Yeah, no, that works.
All right. I love it. I love it. So, today, I'm going to tell you, welcome to Security Tales. It's an honor to have you on today, obviously. We bypassed each other in the hallways many times, and finally we get to sit down and talk. So I kind of wanted to talk about the internet is loud, mental health is being weaponized, and there's a lot of nonsense floating around. So we wanted someone who actually knows what they're talking about to sit with us and break this down. So today we're talking about something a lot of people feel but are afraid to say out loud. Okay. And I know all you tough guys and tough girls, everybody wants to talk that walk, oh, I don't have any issues. I don't have any problems, but you go home and you bring your problems home. So we have more adults living at home, right? Avoiding responsibilities, avoiding discomfort, and in many ways, still acting like kids. Okay. And while calling it self-care, so the more I started researching stuff, I started noticing the term was used a lot, self-care. And I didn't understand that. So the question is, are people struggling or are we just normalizing stagnations? So doctor, once again, it's a privilege and I'm glad that you're here. So for the people that are about to log back on and get on and get going, can you just tell us a little of your history and what you practice in?
Yeah, so I'm a psychiatrist. I'm a Harvard-trained psychiatrist. I did my training here in Boston at Mass General Hospital in McLean, and I'm still on the Harvard faculty, but I have a private practice here in the North Shore in Wakefield, and I see a lot of young adults, children, adolescents, older adults, and we focus on holistic treatment, medication management, psychotherapy, just talking things through, trying to figure out how to get people well and to keep them well. And I'm also a child psychiatrist, so I've been trained to look at things from early on with a developmental lens. Because a lot of this starts in early childhood. It doesn't just start when you're 18. It's a critical phase of development.
So I wasn't even prepared for that one, but so you're saying a parent can notice something in a child from what age?
Absolutely. I mean, honestly, from the moment that they come out of the womb, but in terms of, bringing attention to maybe a child psychiatrist, I tend to work with people as young as 4 or 5 years old. I think a lot of what we see tends to come about more in the school setting, when teachers raise certain concerns. But parents are experts on their children, so they know them best. That's why I work with a lot of parents in terms of figuring out the best way to help their child or their, eventually their young adult child.
Oh, I wasn't prepared for that one. I just started because I had some questions, but once you said childhood, that kind of, I'm not going to lie, kind of really threw me off. So I kind of, if you don't mind, I developed some questions that I wanted to ask you.
Yeah, absolutely.
So one of my questions that, and once again, I kind of poll people and talk to individuals to find out stuff about them. And obviously group of friends and even people at the gym. I'll just come up and say, hey, I'm going to do this and that. Got any questions? Wow, I have this thing on silent and I don't know how it's answering. Oh, there it is. Silence. I'm sorry. I own a business. Everybody knows that. So listen, we're going to jump right into it. When you compare young adults, 18 to 26, okay, because there was a demographic that I attached.
Yeah.
With the same age group 20 or 30 years ago, what's actually changed?
Well, there's been a lot of changes. I think we've seen some cultural evolution, but we've also seen some cultural erosion as well. I think 18 to 26 years old is really a critical phase of development where you're really building independence. You're learning what you want to do in your life. You're building confidence. And right now, we're seeing an increasing number of young adults who are struggling. They're struggling to build that independence. We're seeing more people that are um, stuck in their living with their parents still. They might be dealing with underlying mental health issues, or they might just be trying to figure out what their career is going to be. And so, even with a college degree, they might realize that it's hard to get that first job and to really make it. So, compared to 20, 30 years ago, I think, right now, college is becoming the new high school. Um,
Yeah,
Grad
absolutely.
school is becoming the new college. You need more and more training and education just to compete in this job market and find something. And I do think it was competitive back then, but it's even more competitive now. So I think that makes it harder for a lot of young adults, 18 to 26, um, to build that confidence because more is required. Um, but also we're seeing, that's the cultural evolution piece that I'm talking about in terms of uh, college becoming the new high school and so on and so forth. But there's also been, I think, a little bit of cultural erosion in terms of um, delaying responsibilities and it being increasingly okay to delay those responsibilities.
Well, not to interrupt you, I was going to say after listening to you in the beginning of the conversation, what I gathered from it is just plain laziness. Fair tactic of not coming on and taking your own responsibility to move on forward. So I have a child, 19-year-old daughter, even though we're not close at this moment. Um, I had a great, like, my daughter would wash the dishes, take the trash out, and everything else. And what I see is when I'm at friends' houses that the parents are actually yelling at them and scolding them to go do it because they don't have the independence or the structure to go do it, no matter what they tell them to do it. They're being told to do it and not just do it. And I know back when I was a child, obviously you're way younger than me. I'm 55 years old, and I remember my mother would walk in a room. That's all she had to do because it was a respect thing. So I believe for me being a person on the outside and watching children now, they lack the respect for their parents now. So is it a cultural change? Is it a media change? It's what? So you're basically saying, well, some of them, they have all these stresses. I don't know what stresses they had. I was always scared of my mother's ruler and the Dr. Scholl's wooden slippers catching the back of my head. Now, if they go and do that, they're actually just being yelled at and they're calling the police.
Right.
So
There has been a shift there, and I think it's important not to frame it as laziness per se because it puts all the blame on the young adult. Um, I think what happens is people get used to living a certain lifestyle and they become increasingly dependent on others to do things for them, like parents,
yeah,
right? And so, with that, we see that they're not learning these skills themselves to be able to take care of things. So some of it could be perceived as laziness, could be a motivational challenge, could be underlying mental health challenges. It could also just be a cultural thing where people are getting away with doing less. Um, but that's why I think it's important for parents to have certain non-negotiables that they
so
say,
here's
hey,
my question
you
though,
know,
and I'm going to keep doing this to you.
mhm,
So should we educate the parents to tell them what it's like, to remember what it's like, to re-educate them, to educate their children? Because one of the questions that just popped up is they feel the internet cell phone killed self-expression in individuality. And I can't, that's a big word, individuality.
individuality.
Yeah, there you go. There you go, Titus. Individuality. I got somebody that can speak. All right. So
Yeah,
that's what they're stating right now.
right. Well, I mean, it's an interesting blend, right? Because um, the online world has evolved a lot from 20 years ago. It's basically non-existent,
Yep.
and now that's being used as like the main forum for like education. Google Chromebooks. Kids are having iPads very early on, um, and so I think people are losing that in-person social connection piece and learning how to actually build those relationships in person. And the screens can be a big part of that, right? You can spend your whole day on Roblox or playing Minecraft or playing Fortnite.
And you just said
And
two games that my daughter freaking lived on when she was a child. Lived on that Minecraft crap.
oh yeah,
Never understood it.
and like there can be some educational aspects of it. I mean, obviously it's wildly successful, but when the majority of your day is spent stuck in this inner world, you're missing out on a lot. So I think that's going to
Nothing for
change too.
nothing, doctor. I just saw you just turn around and kind of promote it, but then kind of imploded back about it and said, well, you could use it as an educational factor. Wouldn't
Yeah.
it be better to use it as a you've completed this? Here, go do that for a little bit and actually put a limitation on that?
Yeah. Well, limits are important. I think it's hard for a lot of parents because they see that the kid loves it. You know, it's a reward. They're interested in it. They're passionate about it. But then it becomes a big meltdown when they take it away. So it becomes a battle
So
constantly.
isn't a dog when you give it treats, then
Yeah.
you take it away. So I'm just trying to figure it all out in what you're saying.
Right.
Okay.
Right. It does need to be taken away. I mean, there do need to be limits that are set. Um, I've seen it become an addiction, you know, in terms of screen addiction. So I think
Okay.
there really has to be certain non-negotiables that parents have to be able to set straight with their children, with their young adult children. I mean, one of those would be being engaged in some type of education, training, or formal like employment. You got to get out of the house and get a job. You know, you got to have some
Absolutely.
kind of responsibility outside of the house. The video games, the internet, the screens, that becomes more of a problem when you're not engaged in those things. And so I think we need to have that expectation be clear and consistent um, across the board, right? Education, I mean, even when you're in high school, you know, education
Yeah.
is your job, but like afterwards, what is happening? And it may not be college, but is there some type of training program that one could be involved in, a vocational program, all sorts of things that will help the young adult launch. And I think parents have to be a critical part of that.
Okay. Well, great answer. Great answer. I love that. So listen, one of the three, like I kind of came up with bullet points
Mhm.
after I kind of read it. And to be totally honest with you, when I was younger, um, I lost my dad at a young age. I went to a public school, and principal, like at the time when I went to school, it was more of a smack, a pull, you know, whatever it is. The principal decided to grab me by my ears because I failed to make a Father's Day card and I kept making a Mother's Day card. So they called the principal. I said, I don't have a father, I have a mother. Said, it doesn't matter. You need to make a Father's Day card. Pulled me by my ear and shout out to all my people that went to school with me. And but I bit the principal. I bit her so hard in the leg it was bleeding. She pulled me, dragged me by the ear. I told her I had tubes in my ears when I was younger. I had really massive ear infections, premature. Pulled me by my ear, bit her in the leg. Next thing you know, they got, instead of speaking to me to find out what it is, they made my mother put me in a mentally disabled school.
Oh,
So for over 3.5 years, my mother had a fight to get me out of it. So the interesting thing is, I ended up getting my education more or less from my grandfather and everybody else, and it was more structured. So it's like what I see now is so for my action, I was reprimanded for my actions and I was placed into another situation that I had to conform to. Nowadays, when I see kids and children assault teachers and stuff, they're being patted on the back. So
right.
one of my things I wanted to, and it was leading to my question, is this emotional fragility or is it environmental overload?
Yeah, that's a good question.
Damn right it is.
Uh,
Did you hear that?
I I mean, well, violence is not going to be the answer in the school setting. So I don't think that um, that was necessarily answered there, but it sounds like the school could have done a lot more
Well, I'm not
to help.
focusing on me, but I'm just saying per
Mhm.
se, where I've seen times have changed. Like I know I got Tommy Titus on right now, and Tommy Titus's wife was working here, and Tommy, I'm giving you a shout out, brother. and his wife was school bus driver. He was an officer with me, and wife got pushed by a student that was way bigger than her, and the student tried to assault her.
Wow.
And she stood her ground, but yet she was placed under investigation. Hello, Cece. Oh, hold on. Cece's got to say something. She said, I grew up with live-in housekeepers. Well, I'm sorry. We're not all from a wealthy place. I never had a role model or parents who were present. Not an excuse, but that's how it was. What a rude awakening to figure out my house didn't clean itself. I think that was to you. Go ahead, doctor, please.
It didn't clean itself. That's right. So what exactly do you mean by environmental overload?
So environmental overload is what we see what's going on in society right now. For instance, we got left, right, we got independent. So many children are being manipulated. Like I saw on TikTok the other day where a teacher was actually setting up an ICE protest with 6-year-old kids. So they're being overloaded by what's going on where they shouldn't even be touching base on any of these type of things at this moment because they can't take that in. So they're being overloaded by that. Then they're going over social media and all these other things. Now it's like you're dealing with the house, you're dealing with the outside, and you at 6 and 5 years old are being treated as an adult should be.
Right. That's a lot of expectation.
It is
on a child and on a young adult.
Yeah.
So I think that can definitely contribute to instability. And I think in the educational setting, like we just need to get the basic learning pieces there. It's already so hard it's hard enough as it is just getting the academic piece down, but then there's the social and emotional components that are there within school. And if kids are being asked to do all of these things, it can be environmental overload. I can certainly see that.
But do you feel it's an effect from the adults now? Like, I'm just trying to figure out how to say it with being nice. Cece, now you made me feel guilty, by the way. I just want to say something. Cece states, I wasn't wealthy. My mother was ill and my dad didn't live with us.
Oh, okay.
I just did the wealthy thing to her and housekeeper stuff, and now she's made me feel really bad. So I didn't even want to stay on this too long, but I just because now you're throwing me off. So now what I'm seeing is, and personally don't care about who takes it the wrong way because I'm going to say what I'm going to say, is I'm finding parents that are weak. I'm finding parents that don't want to be parents, and now they want to invest in you, and then you're trying to say, well, you need to correct what's going on with you in order for them to follow what needs to be repaired. So, and parents now are so scared to be parents.
Right.
So my question is, like, to parents that are watching this and people that are texting right now, how do they deal with this? Like,
well, parents, I think, need to be firm, fair, and consistent, but also allow their young adult kids to make mistakes. Right. A lot of parents, in some ways, are rushing to be able to help them, and they're not letting them really learn independently.
I agree with
so
that.
you have to kind of learn from those natural consequences that you make.
So through your failures, gains respect in themselves to keep moving forward.
Well, yeah. I mean, a lot of parents are waking their kids up, their teenagers up, their young adults up every morning, just trying to make sure that they get to school on time, or to make sure that they don't miss that job interview. Right. And it's like, well, if I don't wake them up, then they're going to be late. Well, yeah, they probably will be late. But each time you wake them up, you're reinforcing that they can always depend on you for that. Right.
Okay.
And then that dysfunction can perpetuate later. So it's not to blame any one person. It's more about how do we create an environment where that independence can be built, and how do you cultivate that? Right. And so the mistakes that I'm talking about would be maybe not setting an alarm. It might be not creating enough time to eat breakfast for yourself in the morning.
Yeah.
It might be, maybe picking some friends that might not be the best fit for you, and, learning from those relationships. Because if we coddle them excessively, we end up accommodating a lot of this, and they don't ever really learn until later. So it
Okay.
ends up delaying maturation. So I think allowing
Delays what?
it delays maturation, maturing basically.
Oh, okay. Yes, Felipe learned a new word. Yes, CC, you know I love you. All right, I never heard that word, so I like it. It's a big word. I like it. Okay. Masturation. Okay, I'm gonna use it. So it's pretty interesting, like because I wanted to ask you, are expectations lower or pressure higher on a parent? Because it's pretty interesting that you said step back, let them start to learn to alarm clock, let them cook for themselves, and let them start to develop some type of independency, right?
Yeah.
But do you feel that becomes pressure on the child?
Um, I think there's going to be a natural pressure already, right, through the school setting, through building that independence. So, I mean, you do want to put a little bit of pressure, right? There has to be certain basic expectations
Yeah.
about what's required, going back to your 19-year-old and also, the whole thing about
So when
what
does it
it
start
is.
at age, by the way? Because you just said 19.
When does what start?
When does it start independence? Like I know when my daughter was 5, one of my biggest things were shoes off, make your bed, brush your teeth. That was the hottest things for me, to be honest with you. She didn't want to brush her teeth. She didn't want to leave her shoes at the door. She didn't want to make her bed. And that was every day until she got into this repetitive thing and started doing it.
Yeah, that's about building up the habits of achievement. I think the
Yeah.
independence piece is an evolving target that starts as early as early childhood and continues on, but it can be delayed if these skills are not mastered. So, I mean, with a lot of my patients, even now, who are teenagers, they're still not brushing their teeth. They're still not taking showers. Their parents are trying to figure out, hey, what can we do to get him to shower every day?
I hate to laugh about it, but I know you're absolutely right because I do have some friends that their children, they fight with them,
Yeah,
like to bathe.
and it sounds so basic, but like, how does that become the norm? People are trying to avoid the battle, but I think also it goes back to building those skills for success, right? There's a reason that you want to shower every day. There's a reason that you're going to want to brush your teeth and take care of your dentition. But the young adults and the children have to learn that over time. And I think sometimes you just have to say, hey, this is what's required. This is the expectation. You need to do this so that they can build that habit of achievement over time.
All right. So I have, God plainly says, honor thy mother and father, whether they are two parents in the home or not. Love and respect starts at home. So I don't know if that was a comment or if he's asking you.
I agree with that. It does start at home. That's the foundation, right? The family foundation. We're seeing more single parent households, and I think it's becoming less common that people are married in order to raise children. But also having two parents can help because if you only have one, then there's
That's pretty interesting that you said that because when I did a research and obviously prison background, many years, Walpole Prison, Susan Baronelsi, Northeastern Corrections. Shout out to my guys. But when they did this whole background on all of it, they found out mostly all the guys that were in jail, especially from poor communities, didn't have a father figure. They actually only were raised by mothers. Now, I'm a little different than them. I was raised by my mom. But also I was raised by my grandfather until he passed, and he passed when I was a teenager. But my comment is you're only as weak as the person you're around. My mother was very strong. My mother supported me and my sister, did everything for us. If you had something, we had it. So to me, and never took support from anyone, just did it on her own. Like she could have been on Section 8, EBT and all that. Nope, I'm going to earn my money. Came from another country and built everything herself. So when I see people that say that, and it's just me, because I was bullied when I was young, it was everything, but I call it weakness. So one of my questions is, what do older generations misunderstand the most about what's going on? Because I know me when I hear things, and one of my buddies is saying it like, oh, my daughter, 13 years old, didn't show back home and snuck out the window. I'd be like, you know what? I'd be putting 2x4s up, locking that window, grounding her butt, taking her phone, taking the internet. Oh, she'll call the cops on me. What do you mean she'll call the cops on me? Screw that shit in plain English. So what is it that the older generation is misunderstanding the most? Is it me just not grasping it and understanding?
No, no. I mean, I think you're right about that. I think it's the emotional fragility piece. People are afraid to set those hard limits, and uh, I think we're sometimes giving our young adult children a little bit too much autonomy when really what they need is uh, more rules, more respect to be mutually understood on both sides. And I think we need to have those expectations laid out early on and have them be consistent. So, in terms of the fear of like boarding stuff up, I don't know what that's all about. I mean, typically it shouldn't get to that level where you have to board stuff up, because I think if you start early, and we're addressing underlying mental health issues, hopefully we would be able to decrease the chances that that would happen. But
Okay.
there's a lot of things that can create these unstable environments, and it's not always just like a parenting thing. Substance use
Yes.
can be an issue. Hanging around with the wrong crowd, um, and mental health issues, right? All of those things can feed into it. Trauma, unstable home environments,
Okay.
even poverty. So you can get involved with the wrong crowd and like be involved in like a gang, and that can also
I
create
don't know
more.
why the doctor looked at me that way. I've never been associated to a gang at all, except my gang in blue, babies. Okay.
Yeah, so I just think it's hard to distill it down to like, well, this is what's causing it. But I do think that we want to get back to that sort of state of mind where parents can feel more confident setting those limits
Okay.
and being consistent with it.
All right. So I'm going to end that part of it, but I'd also like to state that from when I'm seeing this, it isn't about weakness. Okay. To me, from what I'm gathering about this, it's about conditions, right? Because you're talking about limited things to them and developing a structure for them, and developing some independency and some type of control that they should start for their own life, right?
Absolutely.
Because I know, being a latchkey baby, you got that, Dr. Wong? I didn't say lock key baby, latchkey baby. I was scolded and told I said it wrong. Whatever. But where you basically have a key, your mother is at work and you go home, you eat your food, you go out and play, street lights come on, you come home. So you're saying possibly go back to those days and develop, because they're still, hey, go do this, go that, ride your bike, get out of this house. But guess what? Come back at this time. This is dinner. This is shower. This is that. Now we don't do that at all.
Right. So I mean, that could come down to a cultural shift as well as basic safety considerations. I mean, we know now that depending on the neighborhood that you're in, that might be harder to do.
Yes, you're softening this too much. I was born in Camden Street Projects of Boston, all right, which was Lenox Street.
Oh,
We
okay.
moved from there when I was 7, but still, I've met so many people that lived in those areas that have been very successful. People up in Mattapan and all these areas that were not necessarily the best area, but are attorneys or Mass State police officers and everything. So you're now saying it's possibly environmental for some, but not for all.
No, no, no. I mean, I think um, getting out into the environment, right? You need to be able to explore the world around you, right? And that's where I think outside of the school environment, having like a social play environment where you can explore
Absolutely.
and develop yourself and your identity is key. It sounds like for you, that was going out and hanging out with the street lights on and that sort of thing. I mean, it
Well,
could
yeah, it
look
was
different.
structured, boys club, YMCA, things like that. My mother would be like, ride your bike. That's where you're going.
Yeah.
Done deal.
And we do still see some of that, with the e-bikes and um, people playing hockey,
Yeah.
especially in the winter on the lake when it's frozen, things like that. There's definitely an important element to that.
Okay. All right. Surprising you didn't say anything, T, on that one. So I want to talk about, seems like environmental overload and high pressure are the main things that need to be changed in today's society, right? But also I wanted to talk about, because you had said something that I was interested in, and for some reason it rolled right into this way.
Mhm.
A struggle that goes undiagnosed, because you said some children could have some mental situations that are occurring. So,
Right.
how often do you see depression and anxiety and ADHD or trauma go completely undiagnosed, especially in families that look successful from the outside? Because what
Right.
I've noticed lately, and it could just be, I watch social media, but I don't watch social media to watch it.
Right.
I watch it to gauge today's society to see what works and what people like. For instance, and I'm not going off the script, but I'm kind of going off. So what I see is this: violence, unbelievable amount of people. Someone gets sucker punch. Oh, they're getting 1 million views. But then I go over and I watch videos from China, and it's someone playing the piano, it's someone singing, it's someone that's basically articulating a beautiful poem, millions of followers. And then I try to look at us and what sells: someone being sucker punched on a bus station, someone being stabbed in the neck. Wow, here is it a cultural difference between like European or different countries than us, where I see the views and all these things that go on. So I'm
That's a
really
good
just trying
question.
to figure it out myself, because when I watch it, and I'm not watching the video, I'm watching to see how many likes. Then I like to see the comments or what goes on.
Right.
And right now, it seems like things are building up against law enforcement, against things where people now that are children are arguing, having their cameras out, telling the cop, go ahead and do it. So I'm just trying to figure out, is
Yeah.
this something that was misdiagnosed from the beginning?
Mm.
You know what I mean? So I'm just trying to, I mixed in a lot of things,
Right.
but we can break them down. But like I just want to know, is this something that I'm not understanding about today's society?
Yeah, no, that's a good question. I mean, in terms of the types of videos that get likes here versus overseas, I mean, that's hard to comment on. I mean, I do know what you're talking about, though. Thanks, Felipe. In terms of the the violence and the cheap dopamine hits that people get. I mean, we're seeing some of that in video games. I mean, a lot of people are playing Call of Duty, and that's kind of what sells, right? Is
Yep, yep.
the blood and gore. But when it's somebody's real life, or a real human being that we're seeing on a video, that shouldn't be glorified ultimately, because it sends a message of like, hey, this is okay, this is what we should be looking for. um, but in regards to your question of like, are we missing uh, certain diagnoses and conditions, I think we are missing a lot of it. Not enough people are getting the mental health care that they need. I mean, I'm obviously biased as a psychiatrist, so pretty much everyone that I see has something that they're working on in this way.
Oh, damn, I'm
But
right sitting beside you. I got so much going on. I got demons in my head.
but yeah, I mean, I think we're missing a lot of substance use disorders. Okay. Alcohol use disorder, cannabis use disorder. A lot of this is starting early on, 12, 13, 14 years
And not
old.
to stop you, I find that pretty interesting that you said that. I was scared shit in plain English to touch anything. I didn't even have a drink till I was 23, because I didn't want to be out of control. I always wanted to be stable. And when you just said that, I'm hearing 9 and 8-year-old kids doing THC gummies,
Oh, yeah.
doing all these things where I'm thinking to myself, you're not even old enough to even walk straight yet. But
Right.
yet, let alone you're smoking weed, smoking cigarettes, and doing this.
Right.
So that's interesting. You said that. So are you seeing a lot of drug use in packing? Like
Uh,
when you're having your patient, do they 13, 12-year olds? Do you see a lot of these people that are dependent on drugs?
not as much in the 12 or 13-year olds, but once we start getting into 15, 16, we're seeing a lot more vaping, a lot more weed use, a lot of edible use is being normalized. It's just, it's just something that we do that helps us socialize and connect. A lot of what I hear is it's the only thing that makes me happy. So
So why
I
does
need to
some
do it.
doctors sponsor THC? And they say they might even prescribe it to you to say it's a
Yeah.
calming effect. I
Yeah.
personally think I've seen people on it, it makes them totally different than if they were straight talking to me.
Right.
So
there's no
I'm
evidence that
None.
weed is beneficial in any way for any psychiatric conditions. I mean, the only things that there's really been some evidence for, and it's really more the CBD component of it, not the THC
minus the
component,
THC.
which gets you high.
Yes.
You know, in certain people that are underweight or might have cancer related, you know, wasting, it can help with the appetite and with the nausea,
Yes.
or like cancer patients who are on chemotherapy and having a lot of nausea, maybe it can help. But in terms of most of the general mental health conditions that we treat, you know, depression, anxiety, ADHD, bipolar disorder, schizophrenia, it's definitely detrimental. And
Okay.
particularly to the developing adolescent brain, uh, we're seeing a lot of negative effects of cannabis and alcohol.
So let's go back for a second.
But why do doctors prescribe it? Because where there's money
Good.
and there's an industry, you're always going to have people that are finding reasons to, you know, to promote it.
Well, that ended my question, because I was going to ask that. Obviously, do you think it's a financial gain that for some doctors, they're basically going to be like, oh, go ahead and take this and try that?
Oh,
right?
absolutely. Yeah.
Okay.
Look at the website. So, oh, this strain helps with your depression. This strain helps with your PTSD.
Yeah.
But
So
there's no evidence.
Because it's interesting. People, you know, that have degrees like you as a doctor and, you know, doing what you do, what I've noticed is, and that's what I was going to bring forward on, is now I'm watching medical doctors now sponsoring products on TikTok, Facebook. I stand by this, I stand by that. The way I'm looking at things now is obviously you're being paid for it. But let me go check out if your family background to see who in your family that you've written out these prescriptions for before you've sponsored this. And it's pretty interesting where and I'm not even going to get caught up in it because it's in a conversation for it. But I remember something that was big that was forced mandatory on us, and all of us had to do it. And the doctor basically stated when they asked, did your family take it? No, I want to make sure everybody else takes it before us because we don't want to run out of it. And if you go back and you research, they never took it. So I find it very interesting in how society manipulates children and manipulates adults that now pass it on to the children. So you had said schizophrenia. Can you explain what that is?
Yeah, so schizophrenia is a psychotic disorder. You know, it's one of the main types of disorders where people can lose touch with reality, right? And generally, to be diagnosed with that,
Not to cut you off, but I'm going to. Titus states, I do like the doctor here. He seems in tune with the generational differences between the us old baby boomers and how we are raised compared to the me generation today. So Titus just gave you a shout out and respect. Titus doesn't do that for nobody.
Appreciate that, Titus. Yeah. I try, and I think part of the reason I can be a little more relatable is because I connect with patients every day, people every day, like me, not like me, people of all different backgrounds, genders, and that opens up my mind to see that like a lot of people are struggling, no matter how rich they are, no matter how poor they are, whether they grew up in Boston or they grew up in California or in a different country even. We see
that was when you brought me and my wife up. What's up with that? 2 states that both of us came from. That's messed up. Okay. So, but I wanted, because schizophrenia, I kind of just wanted to talk, maybe some people that are watching it over there.
Yeah, schizophrenia, in order to be diagnosed with that, you have to have at least 6 months of, I think, 6 months of impairment, right, in terms of the psychotic symptoms that you experience.
So it's nothing to do with an imaginary friend.
Well, that could be a type of delusion that someone experiences, right? So you have positive symptoms, which are your psychotic symptoms, and then you have negative symptoms, which would be things like losing motivation, not taking care of yourself as well, not speaking, and losing motivation, right? But the positive symptoms that we classically think of with schizophrenia would be delusions, right? That's a false fixed belief. Like if I believe that maybe you're an imposter and you're not really Felipe, but that maybe you're somebody else who's here to do something.
I'd like to say my wife has it because I don't think it's her sometimes. Okay.
But that could be a delusion, which could be one of the cardinal symptoms, right? That is a delusion because it's a fixed false belief. If it's not just today that I believe that, but I believe that every time I see you in the hallway, in addition to other potential symptoms like paranoia, that's a psychotic symptom, a delusion, hallucinations, which are where you see things or hear things that are not really there.
Okay, I went through that when I was younger.
Right. I mean, that could be caused by a lot of things, though. I mean, so
I used to hear things. I used to hear people talk, and I swear to God, I used to see people.
So any one of these individual symptoms like doesn't necessarily mean that you have schizophrenia, because people can experience psychotic symptoms briefly. Personality disorders, you can experience psychotic symptoms. Substance use can cause psychotic symptoms. But with schizophrenia, it's got to be there for this set period of time.
Okay.
And cannot be caused by these other factors, typically, in order to actually be properly diagnosed with it. So, you would look for usually a constellation of those symptoms.
Okay. All right.
Those would be the positive symptoms. But after you get treated with antipsychotics, those delusions, hallucinations, the paranoia may go away, but you could still have it because of the negative symptoms that can still remain.
All right, Tommy, you passed the test. It's still you. So I got a question for you. So how often, because I argue this a lot, how often is depression misdiagnosed as attitude?
Oh yeah. I see that a lot, particularly in teenagers and kids, because depression in youth comes out as a lot of irritability. They may not get sad and have the crying spells and the withdrawal that we see in a lot of adults. They will be maybe more combative, more defiant. In addition to maybe, losing their functioning, not doing well in school, not doing well in sports, and, just staying home and being on video games, right? So that could look like a lot of defiance, and it could look like an attitude problem. But when you actually break it down and you assess that child, that teenager,
Yes,
which is a lot of what I do, you get collateral information, not just from the parents, but maybe from the school, maybe from, a sibling, and obviously from the patient themselves. And you dig deeper, you can start to see. But also when you start to see things like self-injurious behavior, even suicidal thinking, that's not
normal.
That's not normal. That's not an attitude issue.
Really?
You might have, and it doesn't have to be either or. You can have both. You can have an attitude issue and have depression.
I always thought everyone has always thought once or twice, not physically, but Jesus Christ, I'd like to kill myself, or Jesus Christ, my life sucks and I want to end it. Yeah. That's not normal?
These kind of statements can be made, and I think that does get normalized, like with a lot of the music that's out there. And, people unfortunately learn to say that reflexively when they're frustrated. But I think it's important to say what you mean and mean what you say, right? Because suicide is a real issue, in youth, children, and adults. And we have to take it seriously, and so I think really educating, that's part of what I do too, is like educating my patients about like, hey, what are you really feeling? You're making these comments. For many, suicide is a solution to a problem that they don't know how to solve. So what is the actual problem that you're trying to solve here? Right. And let's get at what's underneath that and take hurting yourself off the table. Right. And I try to get.
And that's a parent's involvement for that?
Well, I mean, if it's serious enough that, we're concerned about their safety, then it should be everybody's involvement, like they should probably be in the hospital, in a place where they can get the most safe and structured help.
Okay.
You know, if we're legitimately concerned about the safety. But, you know, if this is more of a chronic thing and there hasn't been, um, you know, people are not necessarily worried in that way, I think it's more important to be engaged in treatment, you know, getting
Absolutely.
therapy, coming in weekly.
Medication,
Yeah, sometimes medication,
which we're going to lead into something about that.
I believe
But-
in pills and skills, you
So,
know,
okay.
skills before pills, though, you know.
All right. So my question is this, and this is because you've led it up to this. By the time parents act, how deep is the hole?
By the time they act.
By the time they act.
Act on what?
Act on what's going on with the individual, depression, suicidal thoughts, aggressiveness. Like, how far have we as parents let it go before we actually get you involved with it? Like, what should we as parents, well, I shouldn't even say me, I don't even have a kid anymore, but it's an adult. But what are parents like? What are the signs? When should they get involved when it's no longer looks like it's normalcy?
Yeah, I think it depends. You know, it depends on what exactly we're seeing. And I have parents that, you know, might bring a loved one to me when they're 5 or 6 years old because they're seeing a lot of ADHD and disruptive behavior at school and lack of focus.
Really?
You know, and they need to be treated for that, right? And it's affecting their ability to learn in the classroom and their ability to have confidence and form friendships, right? They're not going to birthday parties. They're not getting invited to any sleepovers, you know, so.
I can answer that right off the bat. Take a freaking shower and brush your teeth and maybe people will invite you. Done deal. Now I can be a psychiatrist. Come and see me.
Right, exactly. But, you know, how deep is the hole? I mean, more commonly than that, I see a lot of people coming in after it is further along, you know, and then they expect a quick turnaround. Like, oh, okay, after a few months, like we're gonna be on top of things, right? And I'm like, no, Rome wasn't built in a day. You know, there's typically some family dynamic issues that have to be looked at, in addition to like a depression within the individual, right?
Okay.
There may be substance use issues on top of that. There might be parental divorce and other strain going on. There could be some type of bullying at school. There could be the learning environment is not the right environment for the child because they might have a learning disability, or they might have, you know, like dyslexia, or they might have just the wrong type of educational environment. And so I think it's usually better to come in earlier if you can,
Okay.
right? I mean, it's better to start out with more resources and more help and then peel that away if you don't need it than to start out with not enough. And then they're already 18, 19, trying to find a way out of the house and haven't really learned coping skills.
Yeah.
Or like any sort of like way to advance themselves. So I say, you know, the earlier you can get in and get the help, the better. There's no shame in that. But the stigma piece, I think, bothers a lot of people. You know, it's becoming more acceptable and should be to
Absolutely.
get mental health treatment. I mean,
Absolutely. I started second grade all the way until I was 14 years old, until Dr. Fuentes moved to California.
Oh, yeah.
Mad shout out to you. You helped me so much. I love the guy. Great guy.
Nice.
But I do definitely agree with you on that. And I think it's a longevity. And sometimes it might never end. Maybe you're always looking for that escape because we always develop another sort of impact that occurs later on in life that has nothing to do with the past.
Right.
Correct?
Right.
All right. I think that was great. So one of my questions is, okay, but I'm just trying to figure out how to say this, you know, so ADHD.
Mm-hmm.
So what a lot of my friends always say, my kid has it. I'm going to put him on Ritalin. I'm going to have this. When's it mistaken for entitlement?
So entitlement in the sense of like just wanting your kid to be the best, or
like maybe it's not your kid. Maybe it's you that has ADHD and you're trying to forecast it on your child because it's your child's not performing where you expected your child to do. So basically meaning if you play the violin or you play the guitar or you play the drums and you started out as same time as the next door neighbor is, and this guy's smoking it and blah blah jam and now I come and see you and I say something's wrong with my kid.
Right. Well, ADHD is something that we should consider and put that on the table as a possibility, but you also want to rule out other things that could be contributing to the concentration issues, right? And like you can meet the criteria for ADHD, but also have other things that are complicating it. And we have to be quick to not just like throw a diagnosis at it. Um, in order to have ADHD, a lot of the symptoms need to be present by the age of 12 or before the age of 12 in more than one setting, not just at home with you not doing your chores, but in school and at home or in church and in school or, because it has to be present throughout.
I appreciate you said church because I'm a firm believer in God.
Oh, good.
So I think you should follow.
Yeah.
But go ahead.
too.
That's just my shout out. And everybody knows how I am about that. But go ahead.
Yeah, but you can see that, right? And like it's easier to diagnose it in boys than girls for many because they tend to be more disruptive with their symptoms. And you can call out that kid in the classroom that's not raising his hand, that's the class clown. And that's why we see a lot of that there. And usually it comes to the attention of a parent through the teachers.
Okay.
So I don't tend to see a lot of it.
You just described me. So every time I got placed in a position that I could not control, I make jokes out of it. And I still do it as an adult because I'm trying to figure it out.
Yeah. And that's fine.
And I also shut down a lot. When something pisses me off, I shut down because I don't want to say something that I'm going to regret. So then I refocus on what the situation is. And then I'm very analytical, I guess.
Yeah.
So obviously been like that since I was a kid.
You've been very resilient and it sounds like you've been able to be very successful despite, a lot of those hardships earlier.
Yeah, but I've had some great people that showed me the way.
That's awesome.
That I continuously meet. And you being one of them, gave us a right to sit here with a good doctor and throw questions at him. And I really appreciate that.
Oh, yeah. Yeah. No problem. But yeah, I mean, in terms of like, there are some parents that are perfectionistic and do push some of that on their kids. They want them to be in everything, in piano, in athletics. They want them to get straight A's. They want them to go to the Ivy Leagues. And I do see some of that.
Do you believe it's something they missed and this is why they're forcing it onto their children?
Yeah, to try to live their life vicariously through the child. Sometimes, yeah, I do see that actually. And I think that's why we have to go back to the kid, and what they really want for themselves. And it's just so hard to know really what you want to do in life when you're 18, 19, 20.
See, that's what I'm confused with. You just said it. Now, you have children, if you don't mind me asking?
Yes.
How old?
We have a 3.5-year-old.
Oh, congratulations. Wait till you deal with them when they get older. Girl or boy?
Girl.
Oh, make sure you keep her tight. They love us for the moment until they turn 16. and then we're the epitome of anything to them. But
I'm struggling already. She's only 3.
Oh no, she's gonna be daddy. Trust me. But I find that so interesting that I'm just trying to figure out how to say it without saying it wrong. It seems to me like the children that I see now and today, by 18, I knew what I wanted to do. I wanted to do law enforcement. And the reason why I wanted to do law enforcement is because I went through that bullying stage. I did that shyness type of thing and, got into martial arts and it helped me structurally, mind control and everything. It showed me not to be violent, showed me to transition myself into a society and a community. And to me, I didn't look at like the word nerd and the popular kids. Everybody's everybody to me, and I was always blinded by that. But now what I'm seeing is kids that go to college at 18, 19 years old, and they're taking liberal, just they're liberals. And I'm like, what do you want to do? In my head, I'm expecting 3 or 4 things. I'm not sure. I'm thinking this, I'm thinking that, I'm thinking that. I'm here, and I just don't know.
Right. Right.
And we were just discussing that you had said that, 18, 19-year-old kids aren't developing their independency and their mother and fathers are still waking them up to go for a job interview. And then next thing you know, I see the same kid working at Targets. No offense, it's a job, but yet they're educated. They graduated from BC, Suffolk University, but yet they're still in that position. And I'm like, so what do you want to do?
Yeah.
I don't know. And now that same kid I saw at 19, I see at 26. They don't know.
Yeah. It takes time to figure it out, but I think, we're also partly responsible for that, from a society perspective and a cultural perspective,
Yep.
right? We're trying to expose them to all of the different types of education. And I think, teenage years are all about like identity formation and figuring out who you are. But not everybody is able to necessarily get there quickly. Even myself as a psychiatrist, it took a while for me to figure out that I wanted to be a psychiatrist.
So when did you go to college?
I mean, I went to college at 18. I went to college in Missouri.
And what did you?
I studied biology.
Okay.
I knew that I kind of wanted to be a doctor, but I was studying biology and French. I thought I was going to be a surgeon, and work with my hands.
Okay.
Which is very different than psychiatry. They're both invasive types of specialties. Surgery, you're cutting on people. With psychiatry, you're getting into the mind and getting to know people personally. And
cutting into the brain, getting to know it, right?
Yeah, I mean, you're learning things about them that they might not even tell their spouse or their loved ones.
Yeah.
And so it's invasive as well, but in a therapeutic way. And I think figuring out what you want to do has so many different factors to it. And that's why I think about high school and college is like learning how to learn, right? Building critical thinking skills. Whether you study journalism or you study biology or you study engineering, or if you're not in college and you're doing, voc rehab, to work in HVAC or be a plumber or an electrician, like you're still building certain skills that are going to be necessary for life. And you don't have to have the rest of your life figured out then. You just need to build certain skills. And then as your brain matures due to the maturation period, you have the experiences that you have, you learn from the mistakes that you make, and you shift gears. Right.
So what I'm getting from this, you're a very sensitive guy. So to me, the way I look at it, if you don't know, it's 17 and 18 and you're living at home, the way I always thought processed is, what happened if I lost my mom? I have to build myself to have stability to stand on my own 2 feet. I need to do something because I only have a mom and it's me and my sister. I always looked at failures. So I didn't want to fail. Okay. I graduated 376 out of my class. There was only 375 students. So figure that math out. All right. So I was surrounded by highly educated students. I was surrounded by everyone's parents basically owned something in that town.
Wow.
Really? It was like my competition was to out succeed them as an adult. Wasn't what was going on there. I needed to do something. I would see my mother working so many hours and go, I want to be my mom, but with less hours. She bought a house in 1976 by herself with no money in a community where it was a mother and father that owned it, a very well-established community where both parents had income that came in. So my goal was to be her, by myself at a young age, and then go above it.
Yeah, that's an amazing goal. So you had a fire that was kind of lit, though.
I absolutely had a fire.
And that motivated you, right? You had something that
I had to outbeat myself every morning, as I do right now. I have to accomplish something to move forward on it. So I'm confused in where, like everybody that I surround with, my friends that surround me, they all own their own businesses. They're all some of them might have been handed the business, but without them being part of the business, that business wouldn't have succeeded. And it was from a young age.
Right. So what makes those people successful and other people not, who seemingly have more resources to be able to do it?
But I didn't have any resources. And some of my friends didn't have any resources, but they picked the resources, made the connections, and then developed themselves further.
Yeah, you were
Um,
determined to be able to do it.
I guess the word is determination, but where is it lost right now with the
Right.
children? Like, where is it where I'm like, and I'm sorry for turning this, but
Mhm.
because I own a company and I've always been in a director's position and a leader, I guess, position. I've had over 300 some odd employees. My company had over 228 employees. And it's funny, I will have people come in to interview 18 and over, only knowing the hours that they're supposed to work. And then they go, I can work Tuesday, Wednesday, Friday, I'm not good. Saturday's a definite no. Sunday, I sleep in. And I'm not even lying
Oh,
about
really?
this.
Yeah.
And I literally sit there and look at them and go, you do know I posted this on Indeed. Just to let you know, the company pays for the posting, but I kind of want you to tell me what the posting says. Monday through Friday position, 40 hours,
Yeah.
8 to 4. I can't do those hours though. Can you work with me? They're coming in to interview me and you're a child and it's a security position, but
Right.
I in my head, I'm trying to figure out, is your mom and dad not going to smack you for coming in here? Or are you just basically showing mom and dad that you came in for an interview for a job?
Right. Yeah, that's a
So
good point. I think
I'm
where is
just
it
trying to
lost?
figure it out. Yeah,
There's a softness there. There's an entitlement that I think is growing, and that entitlement does hold people back.
Mm,
Right. So there's an entitlement piece in saying, well, I got to sleep in this day. And even though I saw this Indeed ad,
yeah,
it's not really going to work for me. That's going back to the fragility piece. So
no,
it actually makes it harder to become independent because now you're expecting all these accommodations when in fact, sticking to that schedule that you require is how you learn and grow. Right.
yep,
And
absolutely.
I think we need more of that, not less. So, as far as the question of why is it lost or where has it gone, I think that could be a cultural thing that gradually is becoming infused into the culture of it being like okay to like try to negotiate your way into something so cush that it's not even a job anymore.
All right. No, I
You know what
agree
I
with
mean?
you. I also think you were lost in my conversation and you were skating around it, to be honest with you. But we're going to let that go. So, the way I look at it, by the time parents act, it's like I feel at the time we act or we should have acted, it's time that we involve you. That's how I feel. But Tommy had written something, and I don't want to miss it. He wrote because Tommy ended up, he's from Massachusetts, but ended up moving to Texas.
Oh, okay,
And
cool. Mhm.
he said, weed is still illegal here in Texas. Medical marijuana, though, is starting to happen down there. But
Okay.
also, he states that we saw signs and symptoms of suicide constantly behind the walls. And when he's saying the walls is the prison system, because we
Okay.
did deal with high rates of suicide. We did real, and Tommy, and you can validate this. He says the ones that took it all the way, surprisingly, we did miss though. And we absolutely did. But
Yeah, I used to work in a prison too, actually.
oh, okay. All right. It is a soldier behind the wall. But I think maybe that later on in life structured me to see certain people and how they act and what we deal with. We would have guys spaz out. Next second, they're cutting, they're slicing. They're actually, chopping off pieces of their appendages. We've witnessed so much. We've witnessed suicide. I've witnessed 4 deaths. We've witnessed riots, suicide. But I also saw an impact, which, and I'm not laughing about it because I know some fellow friends and some of my other friends that passed behind the wall that were officers. It led to drug use. It led to alcohol. When they retired, they couldn't handle it. Normalcy of life wasn't the same because they were so used to going to work, dealing with all that, and then coming out to society. And it's not normal to us anymore. So some
Yeah.
people actually took it there. But I also feel, once again, it's just me. I don't do what you do. I do analyze things. I think a lot of us that jump into the career, a certain percent of us, is because at the time we were so wanting to get on law enforcement and we couldn't at that time that we decided to take that for a second job, and then we end up getting stuck in it. And then I think a lot of the other individuals were individuals that were bullied. Then they want to jump on chemicals, steroid use, and get in there and think they're tough guys and hit dudes cuffed up and stuff. So I think that might stem from their emotional trauma that they had as a child.
Oh, yeah.
And now they're able to forecast it now, because guess what? You hit somebody cuffed up, you really ain't going to get in trouble and you're not going to lose the fight. But that's another story. We'll save that. And I'm definitely going to have you on, especially you work in the prison system. You might have dealt with some situations where you've seen it occur and happen in front of you. And it's like, that's one thing. And Tommy can validate. I don't play those stupid games. It's like, it is what it is. Cuffs off if you're going to be a tough guy. You know, everybody gets a fair one. So listen, we now have adults in their late 20s and 30s living at home. And I love this. Not working consistently, avoiding responsibilities, and still being treated like children. From a mental health standpoint, is this helping or hurting? I know we've been talking and touching base on it. I kind of want to push it and like really discuss it, because as I stated to you, I'm seeing people that are going in and go to school for the month. And I got nothing to say about this because it took me 18 years to get a goddamn bachelor's degree, because I kept going. And then things just stopped me in life. So I can't say anything to anyone about it. But I look at it this way. College doesn't make the person makes who he is. So if you want a job bad enough, you don't have to be educated on it. You just have to attach yourself into it and grow into it. Exactly. Okay. So that's my expectation on that. But what I've been seeing is such weakness in 20-year-old children, but that act like adults. But yet you're still living in your father's basement. You're still looking to stay there. You could be living there with your fiance now. You could be like, oh, I'm going to build an ADU in the back of my mother and father's house. And I'm like, what? And I'm like, just leave the house. And no, this isn't great. You know, I could stay here. And then once they pass, and this is what I hear, once they pass, the house is paid for. I'm going to have money. And I'm like, you're already thinking about your parents' death. You know, they're my age. That's kind of making me feel strange right now.
Oh, yeah.
But
it is concerning.
So when a child's head's already processed that way on what they're going to receive and what they're going to have, and it's like,
that's going back to that entitlement piece, you know, and they do need to leave the home, because you have to learn to spread those wings and leave the nest. And whether or not you're coming into a trust fund or inheritance, you got to be able to build those skills for yourself. Because it also gives you a sense of purpose too, right? When you do something and you accomplish something and you're able to sustain yourself, that helps with your mental health. It helps with your physical health. It helps with your overall well-being, right? And so
I'm hearing you say it. I'm just not seeing it happening.
Yeah. Well, it's tough in Boston too. I mean, with the economy and like how expensive it is to get your own apartment, I can see that side of things, right? It's not necessarily like it was 20 to 30 years ago. It's really hard. I mean, people are dropping a lot of cash just to get, you know, an apartment. So I can see that side of things.
Yeah.
But there's ways to live with your friends. There's ways to, move into cheaper neighborhoods and find your way. And a lot of parents are willing to kind of subsidize the cost of living for their young adult children. But I think there's.
Do you know how old I was when I had my first apartment? Not to shut you off.
20.
17 years old.
Oh, wow. Yeah, I mean, you were definitely ahead of the curve there.
Not ahead of the curve. I just needed to do. That's all it is. And I do apologize for my stomach going off. My wife left the salad at home and didn't give me my food. So that's not dependency. That's forgetfulness. But go ahead.
No, I didn't notice that much. But yeah, I mean, we are seeing that. I mean, the question is that a failure to launch, you know, when people are living at home and not finding their own way? I don't think we can just look at whether they're living at home or not, but what are they exactly doing at home, right? Are they in school? Are they working? Are they finding their way, right? Or are they just engaging in substance use? You know, their sleep-wake cycle is reversed and they're staying up all night and sleeping during the day, not in school, not working. Because that's a big difference there, right? And
Absolutely.
some people can stay at their parents' house and use it as a way to launch themselves further and not have any debt after their training program or college to really be able to find the right partner and get married and have a family of their own. But I think when you're banking on just like inheriting the house and not really working hard and not trying to find your way, that's where the entitlement piece can interfere.
So I got a question. It's not even my question. So I think it's you can you can explain it, but I think it makes no sense. But the person wanted me to ask.
Mhm.
So you're saying when a child goes away to college, they develop their own independency. Now, when they stay home, you're looking at more of a failure, or
No,
is that a lie?
it's not that black and white. I think going to college is typically the time we think about where that begins to start, right? Where you're kind of like seeing, are you going to sink or swim? How are you going to do outside of the bubble of your home?
No.
And actually see and build friendships and have expectations placed upon you that are not directly from your parents, right? So I don't think that's necessarily required to become independent, but it's one of the classic ways traditionally we've seen, because naturally people do try to go off to college and it just separates it in time and space in terms of leaving the house. And that's culturally, acceptable because people have been doing it. But there's also some people that do need to stay home and they probably shouldn't be going off to college because they're not ready for it socially, emotionally, or maybe it's not the right decision. Not everybody should or needs to go to college. There might be other ways to find yourself and build that skill set, whether you're becoming a musician or a basketball player or you're starting your own company. There's ways to do that. And so I think we don't want to get too hung up on whether or not somebody is going off to college. Because I've had some folks too that go off to college and then they flame out after the first year
Yeah.
and they're back. And we're going back
Seen
to
it
the
a
drawing
lot.
blocks.
Yep.
You know,
Absolutely. I've seen it.
it happens. And that's okay. People are trying. It just gives us more data.
Okay. I found with me that when I left public school and I was told by a teacher that I was a loser, okay?
Wow.
That minorities shouldn't be welcomed in this. And I was so happy to see that you died. And you guys know who it is. But he shouldn't have been a teacher. But he used to let certain older individuals come in to beat me up in the middle of the class. But
Wow.
it's not even about me. But I found that I grew. It is actually is about me, but it's about independency. I found that when I left and I went to the vocational school, um, it was hard when I was there because when I went there, it means you only went there because you weren't going to be an asset to today's society. So you need to do a trade
Oh, I
because
see.
you're worthless. Like,
Yeah.
that's what all it was all drug users, bullies, fighters, everybody in there.
And
So
that shifted.
yeah. So once I was, it's almost, you could say almost like a prison, to be honest with you, when I went. You had a fight. They had freshman Fridays, where the lights would go off in the auto tech hallways for the guys that remember this, and the seniors would come down and try to beat you up. And
Wow.
then,
Really?
yeah, but by then I was into the arts, I was into everything, and it didn't work the way they wanted to. And then we had our own little freshman group, and they stayed away from us. But it was almost like that's when I saw my life change. It
Really?
wasn't in the public school; it was the Voc made me grow up.
Yeah.
I had to seek independency. I had to seek new friends. It wasn't people I was born with in the community. It was right off the bat, first day. You're like, who, what the hell? Maybe 3 or 4 of you came from a location, but being in a public school, there was 4 other schools. So one from that I'd never seen these people because, obviously I'm from the north side and then you have west side, whatever. And those are the 5 people that went. We didn't know each other, but we knew we were from the same city.
Oh,
But
yeah.
so you had to make new friends. You had to, take school buses with people from other towns. So I found that made me independently grow because now I'm by myself. I'm on my own.
Yeah.
You know what I mean? So I think it was more, it was scary. It was great because I got to get chocolate chip cookies first thing in the morning. So that was awesome. But other than that, it was I got thrown out to the wolves.
Yeah.
So sometimes I wonder if that's what we should do.
well, you were given that opportunity to fail and to figure out if you could make it or
Yeah,
not,
yeah.
and sometimes that's the tough love piece that is needed. Get out there, fend for yourself.
Okay.
Let's figure it out and see if you can do it. And if you can't do it, find a way to make it happen. How we doing on time? I just want to say, okay, yeah, we're doing good. And the Voc schools, the trades, I think were before like kind of undervalued. But I think now we're starting to see that like people are recognizing, wow, you can actually do really well in the trades,
Absolutely.
much better than people are.
Start your own company,
Start
get
your own
out.
company,
Yeah.
yeah, get out. I mean, they're becoming more competitive. Medford High School now has some kind of Voc
Yeah.
program built into their curriculum, and
It's hard to get into though too. Now they
Yeah.
make it in like one of your assets. Like you gotta. When I went, means you weren't gonna make it anywhere else. Go to the Voc. Now you literally, it's like getting into an Ivy League school.
oh yeah, yeah.
I'm like, what? They're like, yeah, you got to have a 3.8 average. You gotta be almost like fifth in your class. I'm like, damn. And I'm like, well, look at me. I'm smart. But
The tides have turned with that for sure.
So Tommy, once again, we saw signs and symptoms of suicide consistently behind the walls, the ones that are missed. But he also says, which prison or jail did the doctor work in? Inquiring minds want to know.
Yeah. So before I became a psychiatrist and after my first year of orthopedics residency, I needed a job. I had my full medical degree, but I didn't have like a ton of training yet. And I needed something. So the prison was one of the few places that would take me in Missouri. So I worked at 3 different prisons. The first one was Moberly Correctional Center in Moberly, Missouri. It's a medium security prison. After that, I built up a little bit of confidence. I was actually, reasonably liked by the inmates and the staff.
That's all a good thing to hear, right, T? We don't want you to be liked by them.
Right. They used to call me like Santa Claus because I gave out too many medical shoes.
Did you hear that? He was a pill thumper. Did you hear that, T? He was like, go see Dr. Tourjee. You'll get your pills.
They were like, stop doing that, Dr. T. Like,
yeah.
These guys, there are these comfortable shoes that you could get if you had a medical.
We call you white hats. People that give away the show. White hats.
Right. I tightened that up.
Nice.
I just needed to learn. So I started out at Moberly Correctional Center, and then they moved me over to JCCC, which was the max security prison.
That's max, yeah.
Jefferson City Correctional Center.
So a lot of lockdown units you were dealing with.
Oh yeah.
Suicides, depression. Big
a lot of stuff. I mean, they would bring guys to me in chains around the waist, around the ankles. Shackles.
Yeah.
And they'd be like, okay, Dr. Tourjee, what are we doing with the meds? And I would just say, please bring me Mr. Felipe from cell block 8 for his shoulder pain. And they would go in and be like, okay.
Tommy, he used my name. That's messed up, brother.
And then bring them in, and they you would, as an inmate, you would fill out these MSRs, which are called the medical service requests. Yeah. And then they would book you with the doctor. So they actually had pretty decent medical care, considering that these were inmates in prison. They were entitled to receive medical care and all sorts of things.
Absolutely. I'm not against that. I'm just against individuals that were taking care of them a lot more than they should have.
Oh, yeah.
That's all. And I think that's why Tommy wanted to know.
So the third prison I worked at was the minimum security prison. That was Tipton Correctional Center. So Tipton was like the guys could just walk right up to you and be like, oh, how's it going?
Kind of a minimum.
Yeah.
Yeah.
So they kind of rotated me around. But Moberly was the main one.
So SBCC is named after 2 dead officers, Susan Baranowski Center. It's a Supermax. So me and Tommy worked there also together. But he said you don't match the mental health workers we had at SBCC. He seems like someone we could have cooperated better with. Well, God bless you all. My belly's growling too.
Oh, okay. What does he mean by that? Like,
so obviously we're not getting off the script, but a lot of the mental institution workers were females. A lot of them didn't know the boundaries. They ended up having personal relationships with them because, during listening to them, they started to develop this
Yeah.
empathy, I guess, for it, and you're hearing it but not understanding. We hear it too, and we know it's a manipulation, and
Yeah.
we know like they'll come at you with so many stories that are fabricated, but they fall for it. And
Really.
then next thing you know, they're bringing them in stuff from the outside. Next thing you know, they're making out. Next thing you know,
We have seen that, and we did have some of those
you know,
incidents. I mean,
that's what he's speaking on.
I wasn't really doing the mental health care in the prison because I wasn't a psychiatrist yet. So they would let me do general medical care.
Yeah.
So like, hepatitis checkups, hypertension checkups, you know, shoulder pain injections, these types of things.
Yeah.
Which is interesting because that was a lot more responsibility.
Oh yeah. So let me ask. I know we got off the script because every prison talk. So, and I kind of want to touch base on that. Do you feel, even though you weren't a psychiatrist and you weren't in that medical field, but you were practicing to be in that, did you find that as you're listening to these gentlemen and people talk to you, that they could have been helped way before?
When I speak to who?
Like the inmates. Because now I just wanted to say, like, oh my God, this guy probably, because now we're going to focus on, what we're speaking on now, that if you caught them when they were 7, 8 years old, there could have been another lifestyle.
Totally. There could have been a lot of things that were done. There's so many different decision trees that start early on in terms of like what could have gone better, in terms of parental supervision, in terms of being in the right school setting, in terms of avoiding the substances, in terms of getting the right type of sense of belonging, right? Whether it's through sports, through football, through a passion that you develop in high school. Like I wasn't just a nerd in high school. Like I was on the football team. I did track and field. I was involved in like math competitions and things like that. So I was like really branching myself out to find a sense of belonging. And I think the student athlete piece was important for me. And I think you just have to find that connection and that sense of community somewhere, whether it's sports, whether it's school, whether it's, in the church, whether it's in volunteer work. So for a lot of those guys, that was probably missing in addition to early developmental trauma, maybe lack of a parent figure, not having a father figure.
All right.
We do see that.
So now I want to kind of get to the closer of it all, but because one of the things that you had said to me in the beginning and to everyone that's watching, you had basically stated medicines and this and that, but I know for a fact that you're dealing with and I would like you just to establish what it's about. And I just want to make sure transcranial magnetic stimulation, right? Yeah. It's referred to TMS, correct? So first, who's it for? But I'd like you to explain it to the individuals on what it is.
Yeah. So TMS or transcranial magnetic stimulation.
Dr. Wong says hello.
What's up, Dr. Wong? How you doing?
Okay.
Thanks for connecting me with Felipe and vice versa, transcranial magnetic stimulation, it's a device-based treatment. It's a non-medication treatment option for depression and for OCD. That's what it's FDA approved for. So it's literally a magnet that's similar in strength to that of an MRI machine in a coil. And what you do is you sit in this dental style chair and you get the part of your brain that's involved in depression, mood, and anxiety to be stimulated. It's like physical therapy for the brain.
For the brain.
Yeah.
So almost like a stem cell treatment. Not stem cell, a stem EMT, electromagnetic stimulation to the muscle after a tear happens or something like that. You're getting shocks to that area.
Right. Well, it's not necessarily shock. It's using electromagnetic energy, right? So within that coil.
So energy is different from shock.
Well, you have electromagnetic. You have a rapidly alternating magnetic field in the coil, right? And when you do that, you have current that goes through. So we are passing like a light amount of current into the surface level of the brain to activate it.
Okay.
Right? So it's not shocking it, it's stimulating it, really.
Okay.
Just like when you go to physical therapy for, say, like a shoulder injury, like that physical therapist is helping you stimulate it, open up those muscle fibers, strengthen the connections in and around that joint. That's kind of like what it's doing for the brain. And it's FDA approved too, right? It's not just some like cookie cutter treatment that someone saw.
So it's
on a
proven it
commercial.
works
Yeah, it's proven it works.
in time.
Yeah, for the majority of people, 4 out of 5 people have gotten better in terms of noticing significant improvement in their depression symptoms.
Okay.
From what the studies show, and 2 out of 3 have reported full remission of their symptoms for depression. And those studies have been shown to be true for a year out. So the magnetic stimulation is a different way of really addressing depression that doesn't require medications. And it's a commitment because it's 36 sessions.
36 sessions.
Right. So you're coming
daily sessions, or 36 sessions you pick and you go on?
Daily sessions. Monday through Friday.
Monday through Friday. How long is the treatment?
For depression, it's just like 18 to 20 minutes.
18 to 20
For
minutes.
OCD, it's a little bit longer.
So does it matter from daytime, afternoon, or nighttime? Is there a specific time where?
Not really. You just want to pick a consistent time, ideally, that you can come in for the treatments.
And keep them at the same time continuously.
Yeah, ideally.
Okay.
I mean, that's not always possible given people's schedules and things like that. But as long as you're coming in for the treatment, because neurons, that are cells in the brain, they're electrochemical cells, right? So they communicate with each other through neurotransmitters. They talk to each other to communicate, right? And in depression, what we see is underactive portions of the brain, right?
Okay.
Specifically, this part of the brain, the left prefrontal cortex, is underactive in the brain. But if you look at like fMRI studies, you'll see there's a lot of different parts of the brain that are not very active.
Maybe that's what explains about my weirdness. Because I ate a bullet right there. So I got shot there, and here.
Oh, wow.
So right here I have, and it hit my brain. So you think I'm missing something there?
Oh, definitely. I mean, that might even make it so that you wouldn't be able to get the treatment because you're not allowed to have bullet fragments or like things that could heal.
Don't have them. Took them all out.
Oh, okay.
Yeah.
So maybe you actually could do it then.
So to me, I just look at it that it might have just killed it over in that area, and I don't have sensitivity to things.
Yeah.
It's a good thing, right? It's a good thing.
You've had real trauma to that. Right?
My whole life's trauma. That's what makes me who I am.
Yeah.
All right.
You've done really well with it.
I do all right. Thank you.
But yeah, it's a good treatment, and like our goal is to offer like alternative treatments too. To not just say, okay, everybody needs meds or everyone needs therapy.
That's what was my next thing. Meds and the treatment.
Yeah, I mean, a lot of people do come in. I mean, in order to qualify for the treatment and have insurance companies cover the cost, because it's about an $8,000 treatment.
Jesus.
In order to have insurance companies cover the sessions, like the criteria is that you have to meet the criteria for major depressive disorder, severe. And typically you have to have at least 2 to 4 failed medication trials, antidepressant trials. So
Okay.
like Prozac, Zoloft.
So it's not a treatment you just walk in and say, hey, you know what? See if my insurance covers it. You have to be diagnosed for this previously.
You have to have a
taken the
prior
pills.
authorization. You have to be diagnosed with the condition. I mean, you can always try to self-pay for it too, and get it. But like if most people, even the wealthy, are going to want to have their insurance cover it if they can.
Absolutely. Why wouldn't you? You pay for it.
Yeah. And so, you have to have 2 to 4 failed medication trials, typically also a psychotherapy trial where you've done some therapy, and then you have to be depressed. For OCD, most insurance payers are not covering OCD treatment yet for TMS.
Okay.
But they'll cover it if you also have the depression that you're treating along with the OCD.
So you group it together and say, hey, you have them both. Don't worry about it.
Yeah. But TMS isn't just for depression and OCD. I mean, there's studies that show that it helps with smoking addiction, smoking cessation, helps with migraines. There's more research coming out that it can help with stroke rehabilitation, stroke.
Really?
Victims. Yeah. So
when you're speaking about strokes, what does that touch base on? Mobility, to be able to get the movement from the neurotransmitters to try to move cells into that muscle group again?
Yeah, well, strokes are injured brain tissue, either from not having enough blood or, bleeding like a hemorrhage. right? So that part of the brain is damaged and needs to be rehabilitated to reestablish those connections. So TMS,
And it's proven it works for that? Because I have a family member that had a stroke, and now you got me interested.
well, it's not FDA approved for that, but there is some evidence in the literature that's showing that it can be helpful for certain types of strokes. That's why, obviously insurance payers aren't covering for that. But if you look at the literature, you'll see that TMS has a lot of indications outside of just the basic bread and butter stuff.
Okay. All right.
But yeah, I mean, I don't know, with your mother's particular situation, I mean, there's other treatments that are more probably evidence-based for that.
Well, the comment is I like homeopathic medicine. I sleep to chakra music, tunes, and bowl sounds. Would love to try magnetics to the brain. Well, if individuals want to try it out, where can they find your location in order to have it?
They can check out our website, dashora.mentalhealth.com.
Okay.
DASHORA mentalhealth.com, and just give
And
us a
I'll
call.
post it on the YouTube and the Facebook.
Yeah. I mean, we're right here next to Felipe. So, but the other thing is, like, people think that it's like a shock treatment. It's not a shock treatment. When you're thinking of shock treatment, you're probably thinking of electroconvulsive therapy.
Yeah, I was thinking lobotomy when you first said it. It's like, yeah.
I mean, the book One Flew Over the Cuckoo's Nest.
Yep, that's what I was
exactly
what I was associated to.
That's where you're actively trying to create a seizure for the patient to reset their neurotransmitters, and they need anesthesia, and that can cause memory impairment. It's one of the most effective treatments in psychiatry for a lot of things, but it's not without its side effects, and it is more invasive.
Okay.
TMS is non-invasive. You can walk in, get your treatment, walk out, go right back to work.
But you do have to develop a helmet or whatever for them.
Well, so you don't need the helmet. So that's you're thinking of Brainsway, which is another TMS device where they do use a helmet to deliver the magnetic stimulation.
Okay, that's what I read.
The one I use is NeuroStar, which is just a coil that's placed on the head. So you don't need a helmet necessarily.
Okay. All right. Well, for those of you that were as interested as me on that, because I'm definitely going to be looking that up even more, I would like to just say, first of all, Dr. Tourjee, it has been an absolute wonderment to have you on, and I do appreciate it. But if you could give parents 3 non-negotiables to help their kids actually launch, what would they be?
I would say the 3 things would be: get them working or in some kind of school or education. They should be engaged in some kind of education, employment, or training, and that should be a non-negotiable, right? Don't let them just sit on the couch at home and hang out. That's necessary for independence. Number 2 would be to not tolerate any illicit substance use, particularly in the home. Just don't allow it. We cannot create the expectation and the false sense of refuge that it's going to be okay to just smoke a bunch of weed in the house and use a lot of these other illicit substances. Now, I understand that weed is increasingly legal, and same as a lot of other things, alcohol, but not in under 21. And I think, of course, people are going to experiment with things, and that's part of growing up. But it should be a non-negotiable that you don't allow some of this behavior in the house, and that we don't condone that. And the third thing I would say that's a non-negotiable would be to allow, in addition to just like loving them unconditionally, you want to allow your kids and your young adult children to make mistakes, right?
Absolutely.
Don't coddle them. Allow them to make mistakes and learn from the natural consequences, because that's how they're going to build that independence. If every time you're running to their rescue, you're waking them up in the mornings, you're not allowing them to sink or swim in that moment, they're never going to learn. It's just going to reinforce the dysfunction. So, and I think that one's a little bit harder to grasp, because it's like, well, what do you mean by allow them to learn from their mistakes? But there's a framework for that. And I think when we let people struggle a little bit, they find a way, like you did.
Okay. Great. Great. I love it. I love it. So what still gives you hope right now?
Well, I have a lot of hope. I mean, I've seen a lot of my patients get better and do well. Even from ones that they're grumbling from the moment they see me and they say, You're not going to be able to help me. And this is ridiculous. And they refuse to talk. Like seeing them get better gives me a lot of hope, knowing that like I can meet them where they're at and see. Um, and what also gives me hope is that more people are accepting the importance of mental health in this world and not just viewing it as some type of weakness or vulnerability, but actually as a strength, particularly for a lot of men and men of color and everybody, like we want to be able to break through those barriers. So that gives me hope too, that we're seeing more of that. We're seeing rappers rap about mental health. We're seeing football players talk about the importance of it. So that gives me hope as well.
Great, great. So me personally, what I've taken from this today, and I do appreciate you taking your time because I knew you had to move some patients around to come and see me. We both obviously have our phones going off. So what I took from it all is I see you not only almost like a job I do because I'm a private investigator.
It's pretty cool.
I see you as a private investigator because now you're trying to get informative information of the individual that they don't want to share with you. Then, almost as you develop a mentorship where they start to respect you, that's where they start to get engaging with you. So, I do think that your position in life is valuable. But what I also take away from it is you deal with so many people that it confuses me how you have an outlet that you don't bring it home, that you can establish the separation from what you do and so much of what you've taken in and not bring it home. So for that, I do appreciate that because I'm not going to lie. I always see you walking around all calm and I'm thinking you're doing weed. And I'm like, this dude's seeing people all day long. Who knows what he's dealing with in there? And he's just walking around just like life is nothing. But I also look at someone as you, as my wife, as a doctor, that you guys to separate what you do to come from a whole front, raise a child, have a relationship, and have some normalcy without passing judgment on everyone else. Because I'm sure, and there's no question, because I know when people meet me, as my wife did, she's like, "What the hell?" And I'm out there, and I admit it, but it's that's what makes me so outgoing. I'm not afraid to talk to anyone. I'd rather have more people that I can engage with than more people to go against. So me personally, what I've taken away from this is a little gratefulness of the position that you've done. Because like I said, I did see one when I was a child, but never actually sat down and speak to one to get as much information that I did. And
yeah, it's really important. And I can't say that I have all the answers. I'm a physician and, but I think part of that is like having an outlet. I try to exercise most days of the week.
Yeah.
I run, I lift weights. I mean, it may not look like it compared to you, but I
wish. No. Now I have to hear my wife telling me, "Look how good she looks, great now." But no, she really does. And but now I'm in competition with her all the time. Oh, you going to cardio today? No, I'm not. Oh, I'm gonna go cardio. So that stuff affects your mind. But but and I understand that.
Yeah, and I have my own therapist too. In our training, we're told that you're going to be more effective with your patients and also just be better in life if you can get your own help.
Really?
So
see, I wouldn't know that.
I have a therapist who also happens to be a psychiatrist, and there's no shame in that.
No, not at all.
It gives me an outlet too weekly to be able to talk about what's going on with me. And I think it's important to carve out that space and time for yourself to be able
great
to work
advice.
on yourself.
Absolutely great advice. I appreciate that.
Because otherwise, I'm not practicing what I preach, and it is hard.
All right. I love it. So listen, everyone, I do appreciate everyone that have watched and the people that will watch later on, and I do appreciate mad love. The problem isn't that people are broken. It's that too many people are being misled about what growth actually requires, and conversation like this matters. I think it was a great conversation. I think a lot of people take away, especially on the Facebook. Also, I see a lot of people. I, for some reason, couldn't get your questions over here, so screw yous. I'll look at it, and then if I have anything that the doctor needs to know, I'll definitely pass it on, and then I'll put it on the notes. So please leave the comments also, and also on the security tail segment. I really do appreciate Dr. Tourjee. I really humbly appreciate you showing up and spending time. I know it was a long time, and I do appreciate it.
It's all
So
good. I want to do more of these.
no, definitely. And like I said, I'm always welcome. I would love to have you, my wife, on, and because she deals with a lot of patients that also should seek counsel. So but that would be her to speak on. We've had doctors, cancer doctors on, we've had heart doctors on, and it's so welcome that you guys take your time out. But I think a great collaboration with today's times and what's going on leads to success in all of us. So once again, I do appreciate you.
Absolutely.
Pleasure. Hey, I'm signing off on YouTube. See ya. Hello. Excellent job today. Love this. Appreciate it. Thank you so much. And there'll be a lot more streams like this. And once again, Dr. Tourjee, you can find him in Wakefield, Mass. Thank you so much, everyone. All right. Now I got to go to